This is not something where we woke up one day and suddenly we have migraines.
Yeah.
I mean, this has been around forever.
Right.
What is it about having a migraine, or what is it about going to your doctor and saying something's wrong? Why aren't they seeing it?
Why aren't they picking it up?
Yeah.
They don't listen. Medicine is an art, it's really not a science. Everybody's an individual. So my years of experience at the Diamond Headache Clinic, all the patients I saw, they all had a different story, an individual. People are aware of headache, and it's a lot better than it was 20 years ago, 40 years ago. And, but you just have to be a doctor who's interested and is willing to listen to their patient.
I always say that there are two sides to migraine. There are the physical symptoms, which doctors treat, and then there are the emotional symptoms. The grief, I'd say almost everything comes down to grief. Grief over not being able to go to your kids' soccer games or going to family dinners. Just so much, you miss out on so much of life with migraine. I'd say my most effective tool, it's sort of been evolving, but I use mindfulness because, you know, that's the buzzword these days. Accepting that I have chronic migraine and that it's a part of my life has been really helpful. And that's not saying, that's not giving up. It's not resignation. It's that this is something in my life that I'm going to have to deal with, and I can't just put my life on hold while I'm waiting to get better.
If there was one thing that you wanted to say, what would that be?
Always keep trying. Unfortunately, I can't really talk about the treatment that I'm using right now, but I'm getting a lot of benefit from it, and all that research that felt wasted, like, you know, figuring out my triggers and stuff, that's all coming into play. And it's been really hard work, and I've certainly taken treatment breaks. There have been times that I'm just too sick to research and do all the work necessary, but I have kept trying, and it's actually making a difference. And even though for 15 years I thought that it wasn't.
Mm-hmm. Talk a little bit about why so many patients, and they probably come to you, feeling dismissed.
They feel dismissed because, frankly, in many cases they are dismissed. If you are a clinician who's used to seeing a patient every 10 or 11 minutes, how much can you tell your doctor in 10 minutes? You know, how much can you tell them? So they feel dismissed because they are dismissed. Headache medicine is a very time-consuming specialty.
Why did you get into this line of work?
I started with very high acuity in neuroscience, working in neurosurgery and neurotrauma with some very high-level neurosurgeons for 15 years. So I've seen everything. That's really given me a sort of confidence that's helped me in this specialty. But I've also seen throughout the years how neglected that community is.
So that actually brings us to some of the questions that I have for Terry, and that is access to medication and access to treatments, especially the new ones.
In Patients Rising, we don't just focus on migraines, we focus on anything. And we've spent a lot of the past year of our existence basically taking a look at what are called value frameworks and how insurance companies are sort of creating these formulas or formularies to deny or include new medications. And their job was to sort of rein in who was going to be covered and who was not going to be covered. Now, the reason we look at migraine patients now is they haven't had a new drug in like 25 years, right? They haven't had a new treatment. So you have to always think about treating the patient first. We have to figure that out first.